Yeah, like you said, the levodopa extracted from it. Even the modern scientists have also acknowledged it, and WebMD website mentions that cow hage or Kapikacchu contains levodopa or L-dopa, a medication that is used to treat Parkinson's disease. Symptoms of Parkinson's disease occurs in the patient due to low levels of dopamine in the brain, and L-dopa gets changed into dopamine in the brain. So clearly what our Ayurveda Acharyas explained as Vatahara, clearly seen its action as its utility is very well documented in Parkinson's disease, sir.
Definitely, not only in Parkinson's disease, almost all the Sarvanga Vata, we can say even Kampa Vata, or even we have amyotropic lateral sclerosis. Such type of conditions are there. This is called as a motor neuron diseases, and these type of motor neuron diseases also we can use this particularly Kapikacchu in a very versatile manner. This is of definitely of late there are many patients also increasing with these conditions, neurological disorders and motor neuron diseases. And definitely in this area we have a very good drug in the name in the form of Cowage or Cowich or Kapikacchu.
And I mean, Acharyas have clearly mentioned these are a compilation of it's a pharmaceutical action from various nigandus, including Charaka's description. Clearly, they have explained as broom honey, kind of nutritive, tissue building, and probably it is this action that nutritive, nourishing, tissue building, muscle strength, improving, those are getting used. Its utility is clearly seen in, say, muscular dystrophy, even in like Duchenne's muscular dystrophy and all.
Definitely, in all those conditions where Vata is severely involved and causing conditions of neurological deficits, in those areas, definitely Kapikacchu is one of the wonder drug which can be used alone or it can be clubbed together with Ashwagandha, Shatavari, and Vidari, even Gokshura. These are all supported in a very beautiful manner, and they can be used in the form of Gritha, which is very good. It can even cross the blood-brain barrier and reach to the higher centers where it is required, or even it may even used in the form of kashayas, in the form of it can be used in the form of churna, it can be used in the form of modaka, or even it can be even boiled with milk and can be given with that. So that type of versatility is there with this drug, and it is a very wonderful drug which gives even promising results, and that is very convincing.
I was just searching Master Charaka's reference. Like you told, he has utilized Pikachu in various forms. Like I was able to track down this Sarpi Guda combination of jaggery and ghee there, which not only contains Kapikacchu but also many other Divaniya and Brahmaniya herbs, nutrition promoting, vata balancing herbs used in Shukrakshaya, Karshya, Nidrakshaya. So, so not only in the tissue, even at the brain level also, wherever there is depletion, it acts. So probably one of the good nourishing and nutrition providing neurological herb, which can even be used in old ages also, sir, because in old ages we tend to lose tissues very quickly.
Definitely, it is not only in old age. Nowadays, we could see from the fourth decade of our life, many patients are there with Majjagata Vikaras, or even you can call it as cerebrovascular accidents or motor neuron diseases, or even Parkinson's, or even many types of Duchenne syndrome, and many such type of things are there. If you could able to use Kapikacchu in a right sense and right manner, definitely we are going to at least control the disease, and at least we can make the disease to be stable. Because these are all motor neuron diseases, and these things are usually progressive diseases, and if that progression is also halted, then it's also very wonderful.
Yes, sir. And while prescribing it, should be worried or should be focusing on any side effects, or and how long can it be advised safely? In what dose?
As it is one of the Vrishya Rasayana Vajikarana Dravya, it can be given for a very, very long time without any side effect, because it is falls under the category of swasthahita dravya or rasayana or vajikarana dravya. So such type of drugs, it can be given for a very long time, and it won't cause any untoward side effects or anything like that. Of course, if you skip the therapeutic dosages and if you increase to multi-level things, then there may be some issues. Otherwise, it will not be having any problem as such.
And in case of Parkinson's disease, if the patient is already taking the modern chemical drugs like L-Dopa, which is available in the allopathic medicine section, if he is taking, can he take Kapikacchu along with that, and can an Ayurveda doctor prescribe Kapikacchu even if he's taking modern medicines for Parkinson's?
See, a very simple reason. A person who is suffering from Parkinson's while already taking some medication from the Western medicine, and still he wants to come to an Ayurvedic doctor, then there is a still deficit. So that deficit part, whatever the patient is feeling, that needs to be covered up. So in that scenario, it is better we can select certain drugs of our Ayurveda and we can use it in a along with all those modern medicines what they're using it. So no need to stop them. Just to give a half an hour gap between those two categories of medicines, and later just add on these drugs. When these drugs are added on, definitely there will be an improvement and which can be noticeable. So that type of improvement is to be taken care, and of course patient will get the feedback and even the doctors also will get the feedback. Based on that, we can fix the dosage of the Kapikacchu what we can add on. Maybe 2 tablets of Kapikacchu Ganavati twice a day. Maybe later we can, depending upon the improvement in a condition or a patient's feeling, then we can convert it into 3 times a day single tablet, or maybe 2 tablets 2 times a day, or single tablet 2 times a day, something like that. So that can be type of altering the dosage that can be done based on the outcome of initial therapy days. So that can be done very easily adjustable, and we don't find any such untoward incidents with the use of these things concurrently.
And